All right, episode 38, social witnessing with our new friend Ainslie. What's up, Ainslie?
Hi.
Hi, how are you guys?
Good.
Good. How are you doing?
Pretty well on this Saturday evening.
Awesome. You came really highly recommended by our show producer. She said you're doing a lot of awesome work.
Well, trying my best. Yeah, I'm a social worker, but I've been home a lot the last couple months, not being able to go out and work in my placements like I was hoping to. But I got back into the hospital this week, and it felt really good to get out of the house and a little distance from my children. And yeah, it was awesome to get back out there.
Yeah, we had one of those days today where some distance would have been fun.
Distance would be good.
Yes, I love my children more when I'm a little distant from them.
Right. So yeah, we'll get into your work a little bit, but first we usually start off by asking people kind of how their last few months have been, what the experience is like, how much social distancing they're doing, how much isolating, and kind of that whole story from beginning to end. Would you like to share some of that with us?
Yeah, for sure. So I was up in Powell River in the second week of March. I was up there for a placement at an addiction treatment center, doing a placement there, and things were starting to ramp up. I remember being in the facility when we heard that Justin Trudeau's wife Sophie had contracted COVID, and I
Mhm.
thought that was something. And then as I was coming back on the ferries, you could just tell things were just tenser. I was recovering from some kind of illness, and I was really nervous about coughing for fear of getting many evil stares. And ferry workers were cleaning everything. It just had a very different feel, and I could sense the anxiety as I was coming back from Powell River, which was on the Sunshine Coast. And then when I got home, my family and I, we were meant to go to Victoria. It was the start of spring break. And we were meant to go to Victoria for 4 or 5 days for a little mini getaway. And it sounded like everything was just shutting down.
Mhm.
Mm-hmm.
And so we decided to cancel because we figured we'd rather be home with our kids with toys and books than somewhere else where there might not be any of that, where we were going to stay in Victoria. And then from there, we just had a really low key spring break, tried to still do some outdoors things. But yeah, we felt really scared because I believe my partner has had COVID back in January and was hospitalized.
Oh, wow.
So
Wow.
we're just waiting on blood results on serology from that right now. We should get it in the next week or two because he was admitted just days after January 1st, so the first few days of the new year, and it hit him like a ton of bricks, and we didn't know what was happening. He's a healthy 37-year-old man, and he ended up in the hospital ICU with atypical pneumonia, and we had no idea what that was about. And that was only when there were just the start of whisperings coming out from China at the time about coronavirus.
Mm.
So there was no test offered at that time. However, our doctor contacted us in March, right before I went to Powell River, and said she was pretty sure that my husband Spencer had COVID. She said, I have no other way of explaining why he got so sick so quickly, and he had to be put on oxygen, and he now has permanent scarring in his right lung
Wow.
from that experience, and it was really scary. So all that to say, we were taking things really seriously, and we started putting up physical distancing in place with all the grandparents and family members. And yeah, we just kind of really hunkered down. And as a self-identifying extrovert, I found that very hard.
Me too.
Right?
Yeah.
Right? It's tough. I don't know about you, Michelle, but those first few weeks were hard, and I was emotional and anxious, and I couldn't focus, and I was meant to be working from home, and I couldn't get things done. And the kids were around. My kids are 5 and 7. And, it was just a very tumultuous time. However, we did eventually settle into more of our routine. And, as I think we're just so resilient as people, and we do adapt and we do adjust and we do get used to different things and to a new normal. So we did settle into it as best we could. And yeah, we've been doing that for the last about almost 2 months.
Mm-hmm.
Yeah.
Are you living in Vancouver?
I'm in Richmond.
In Richmond, okay.
And
Yeah.
how's your husband doing now? How has the recovery been?
Well, he's fine now, but in January, so he spent 3 days in the hospital, and then he came out. He was in a wheelchair. He was not able to get up the stairs in our townhouse. It was a recovery. It was like I had to care for 3 children when he got home,
Mm-hmm.
and he had to take 2 weeks off work with follow-up chest x-rays, blood work, and liver ultrasounds because his liver was shutting down in the hospital.
Oh, geez.
And yeah, it was, when I look back now, I'm actually really glad that we didn't know anything about COVID.
Mm-hmm.
Yeah.
Because I think I would have been much more scared. I was kind of just feeling like it was a bit of a man flu at the beginning.
Mm-hmm.
And then, of course, when he went into hospital, I knew it was much more serious. But if I had known it was, or if I had suspected that it might have been COVID at that time, which I wasn't even aware of, I think I would have handled things, even worse. But yeah, no, he recovered, and he does have the permanent scarring on his lung. But our doctor says because he's relatively young and healthy, otherwise, it shouldn't impact him in the long term. So.
And what kind of testing are they doing now? How are you just now getting results?
Oh, he joined. He asked to be part of a study through the CDC, the Center for Disease Control, and he went into a clinic. It's actually the Vancouver Travel Clinic, because not many people are traveling right now. So he went. He got accepted to do this study, and basically what he's doing is he's part of testing the tests. So they're trying to create these rapid, serology tests to see if you have antibodies of COVID in your system. And one of the byproducts basically of this study is you will get your own serology done and know whether you have the antibodies. So he told me that it was a week ago yesterday that he went. It was really fast. He answered a questionnaire. He saw a nurse and a doctor. They pricked his finger. They put it on. He described it as like a small pregnancy test.
Mm-hmm.
They put some blood on there, and then they took a couple of vials of blood from his arm. And what they're trying to see is if they can replicate the results on the small pregnancy test looking thing, on that test repeatedly to see if they're accurate compared to the lab results of the vials of blood.
Mm.
That's pretty interesting.
Yeah. So,
Yeah.
it's definitely, the purpose of it is not to get your serology results. However, because we have strongly suspected that he and maybe I and the rest of the family have had versions of COVID, we thought, he should go and do this.
Mm-hmm.
And of course we want to know. Yeah, so that's what's going on with us here at home in Richmond. And
Did
yeah.
you guys get sick as well in any way?
Not initially. We actually quarantined him upstairs in the master bedroom when he did get sick with what I thought was just influenza. And I ended up sleeping on the couch downstairs for 4 nights. And he was upstairs, and our girls didn't go in the bedroom. They just said hello and talked to him from the doorway. There was something about his sickness that I knew I didn't want to get. and yeah, he had high fever, sweating like crazy. I was constantly taking his temperature. He was taking Tylenol and Advil, and it would come down, the fever, then it would go back up. And I just knew, yeah, this is not good. I don't think I want to sleep in the same bed as him. He really did not leave the room hardly at all for 4 days until things got worse and he started vomiting after not eating anything. So it was just bile, basically.
Mhm.
And he started to get pain in his back, which I believe was the pneumonia, and he was getting short of breath.
Oh,
So it all sounds very COVID-y, doesn't it?
yeah.
Hmm.
Yes.
And then, and so you guys didn't have anything like, not, did you have any symptoms now looking back?
Not at that time. The girls and I got sick at the end of February. So that was quite a while later, a month and a half later.
Right.
And the girls mild. However, my older one, she did get sicker than she normally does, just with a cold. And we kept her home from school for 2 days, which is unusual for her. And then I got quite sick. And again, I thought it was a flu. And I didn't leave the house for 4 or 5 days and just slept on the couch with extreme fatigue, bad cough, fever, chills. And I wasn't offered, I did go to the doctor, but I wasn't offered a COVID test at the time. She thought it was bacterial. And so she put me on antibiotics. But I honestly, I don't think though, I took the course, but I don't think it was bacterial. So
Mm.
I'm now wondering if that was a version of COVID as well.
So if his test results come back and he has the antibodies, do you think they'll allow you and your children to get tested as well?
I think eventually, I definitely don't. I think with this study that is now over and they've gotten all the people that they need.
Oh.
So I don't think we would go through that way. But if they do come out with widespread serology testing, I would definitely like to get that test. I have no idea how easy it's going to be and whether you need to be referred by a doctor or if you could self-test. I mean, it sounds like they want them really rapid. They don't want you sending blood to a lab.
Mm-hmm.
I think they want to be able to do point of contact testing. And so really just the prick of the finger and then put it on a little slide and then have it read. So yeah, I mean, I would like to. I think it would help us feel better moving forward. It would give us some good information. And, maybe a little bit of confidence and sense of safety or security. I mean, it's still so new. We don't know a lot about the virus still, but from what I've been reading, it sounds like you would have a bit of immunity, at least for a while, maybe a year or something. So yeah, it'd be nice to know. So we definitely would like to know whenever that is available a little bit down the road.
We've actually talked about this before, but if you do get tested and you guys all have the antibodies, do you think you would be more lax with going out, being around people, that sort of thing?
Yeah, I think so. And I think because we so strongly believe that we have had it, we've been definitely more worried about our parents and, older people. Not we haven't really been so worried about ourselves. Of course, we want to protect other people around us, and if we've touched things, we're very careful about washing hands and not getting close to folks. But yeah, I think it would give us a bit of extra, confidence about going out and resuming some activities. And we're also hoping we could be, helpful and go out if it looks like we do have some immunity, to be able to fulfill, our jobs or different roles in the community that other people might not be able to, but that we would have the health capacity to do so.
Yeah, I feel the same.
Yeah.
I think if I knew I had, he's probably going to give me a look, but if I knew I had antibodies, I feel like I'd be good until the end of the summer and then we'll see what happens. But I feel like I would have the confidence to go out until the end of the summer, until something started to change.
Yeah.
And we'll see what happens, but I'd be living my life for the summer.
Right? I know.
I'd be out there.
Yeah, I think it would give a lot of people a little boost. Be like, okay, I've had it. It doesn't look like people get really reinfected, at least not yet. And let's go enjoy ourselves and relax a little bit after all of these. I mean, it's only been a few months, but I'm noticing, people's mental health, and people are struggling. And I feel like when Dr. Bonnie Henry and Adrian Dix announced, the phase 2 of the beginning of relaxing some of the protocols, there was this almost like palpable sigh of relief, and people got excited, and a sense of hope was returning. So I definitely think we're ready to move forward, of course, carefully. We don't want to ruin the good work that we've done, but yeah, I think people are isolated or just frustrated, annoyed, irritable. I was definitely feeling all those things more so at the beginning, but just tired of this.
Yeah.
As important as it is, but we're tired. It's taking up mental space. It's taking up just energy that we could use to do other things.
Yeah. I've spoken with a few other people who have like underlying health conditions or autoimmune conditions. And I know like the relaxing of the social distancing and things like that was actually quite stressful for some people that I know, because they're just afraid, like, okay, so this puts more pressure on either that I have to come forward and I say I have these things, like to your employer, when a lot of people don't tell their employer, like you'll have to come forward and tell them so that you don't have to go back to work. And then, that fear of like, are they going to force us to go back to work? Or even like I know a self-employed person who's just really struggling with like how she gets back out there with her business and stays safe. So I think it's good for the majority. Like I think the majority definitely gets that sigh of relief, but I feel like for the people that are a bit compromised, it's a little stressful to know that people are going to be out there again, and then we'll see what happens. Like,
absolutely. Yeah. And my sister's a nurse, and she's actually working on a COVID unit in Vancouver at the moment. So, I mean, she's seeing firsthand, mainly people from long-term care in the Vancouver coastal health region being put on her unit. And so, I mean, she's taking things very seriously, and she's seeing people who are very, very sick. So she's, doing the utmost care. I know she canceled her gym membership for a while. I was doing grocery shopping for her and just dropping them off at her apartment, but not, like no contact with her or anything. Definitely. I think it just depends. I think it depends where you are kind of along the spectrum of risk and how well you're doing at home, staying home. And how at risk you might be to get it, or if you have any underlying conditions.
Yeah, I'd be excited to get out. Like, you're in Richmond, so we're downtown and we're leaving downtown, and I'm just excited to be able to go for a walk without so many people on the street. There's a lot of people out in the West End. I think even just trying to escape their apartments, like just to get out for a bit.
Yes.
But so I think no matter what happens, just being able to be outside once in a while, I'll start to probably feel better, I think. I hope. But,
and yet I think everyone feels that. And then we're all going to, flood English Bay and Kitts Beach. And then it could be not very good results. So I don't know. I've been struggling with the closure of the provincial parks, although now they are starting to reopen. And the message of, it's okay to go outside. Yeah, but everyone's outside at the same places because there aren't as many places to go. And everyone's staying home, and no one's going, further afield for vacation. So there's just more density.
Yeah.
And definitely, in Steveston, I'm here in Steveston and over at Gary Point and in Steveston Village, like it is busy and tons of cyclists and people walking, and it's hard to keep your distance when you're out, even just for a walk for pleasure.
I'm interested to see what's going to happen here, because the more and more I talk to people around BC, they really see this as a Vancouver, like Metro Vancouver problem, that we're kind of the reason all these restrictions and things are happening. And then I was actually speaking with my friend who lives in Victoria, and she says I think on the island they're down to one active case.
Wow.
And, but the thing is, they still have like people coming across on the ferry, and like they have to import goods and stuff, so they're still following the restrictions. But she's like, they feel like people there are starting to really feel like this is a Vancouver problem.
Oh my gosh, we're so badly behaved, aren't we?
Yeah, it's just we have so many people in such a small area.
Oh, and I think there's probably also an entitlement thing. And, we want to enjoy our amazing city and the
Hmm.
surrounding areas, and we feel like we're entitled to. So I know, and then all the shaming on social media happens and people taking pictures. And I don't think that's very productive. I think it's actually counterproductive. And I don't know. People need to put their anger elsewhere. People are going to do what they're going to do. And we just have to be good role models and, I don't know, be kind and compassion. But I don't think this public shaming is helping anybody.
No, probably. I think maybe in the beginning when it was, really spreading and we didn't know how to, like, they didn't really know how to stop it yet. I think that was a good time for it because there's just so many people that weren't listening. But I
Yeah.
feel like now people are taking a few more precautions at least. And,
Mm-hmm.
but
Yeah, no, I'm pretty impressed when I, go to the grocery store once a week. And I very, at the beginning, begrudgingly put on my mask, but now I am very behind it. And I think people are more on board. And again, we adapt
Mhm.
and we do change, even though we are resistant to change at first. Humans, we do adjust. And I think we are adjusting to whatever this is, how long this, maybe there'll be some permanent changes and things. I hope I don't have to wear a mask forever at the grocery store, but yeah, I think we can do hard things. We can learn how to adjust and be flexible.
Yeah. But maybe this will also teach people, like, whenever they're sick, to wear a mask. Like, maybe I hope people are learning because I don't think that's really part of our culture. Whereas
No.
in other countries it is. If you're sick, you wear a mask if you go out.
Yes, and don't go to work for,
Yeah.
for goodness sakes. I think we're such a culture of going to work when we're sick. And it's sometimes, and I've been guilty of this as well, it's more work to be off sick because then you
Mm-hmm.
have to, for myself personally, I have appointments scheduled with clients, and rearranging all that can be a real pain in the butt.
Mm-hmm.
But I think we have to be really more flexible, or just more forgiving of ourselves, and put our health first, which actually then puts everyone else's health first, and stay home when we're sick.
Yeah, exactly.
Right? Yeah.
Yeah, and hopefully employers too take some responsibility, and so people don't feel pressured like they have to go to work
Mm-hmm.
regardless.
Yes. Yes, totally. I really hope that they're you know, taking this really seriously and looking at employee health and productivity and whatever else, and how, if someone comes into the office or workplace sick, you very well could be giving it to other people who will then be off. Some people will be off regardless
Yeah.
from being sick. So I hope people stay home whenever they do, catch a cold now. I think we're going to be kind of, I think, looking at people for a long time whenever they sneeze or cough, especially have, bad coughs. I think we're going to be I hope we send people home.
Yeah.
Just go home. We don't want your germs at our place.
Yeah.
Yeah,
Yeah.
Michelle's had like a cough for like 3 months, which she's had for the last couple of years,
Yeah.
a couple of times, and I still give her dirty looks when she's coughing too much. He's just like,
No,
what how
I
did you
get
pick
it.
something up here?
Yeah. Even
Yeah, no, go ahead.
even in our elevator yesterday, someone tried to get in with me again. And like I'm coughing all the time. Like it's a light cough, but
Yes,
like you should be afraid. Like we don't know each other intimately. I could just be out here living the COVID dream and just,
Yes.
super, what do they call those people?
Super spreader.
Super spreader over here.
Super spreader. Yeah.
You just
Totally.
don't know.
I'm also a lifelong cougher and throat clearer.
Oh.
I don't know. I must have postnasal drip just forever with sinus infections or
Mhm.
something, but I'm always clearing my throat. And I'm like, God, people must just think I'm a vector, just spreading my germs around. But even when I'm healthy, it's just a lifelong cough,
Yeah, I feel pretty healthy.
Yeah.
And,
Yeah.
and how's that been? You said you went back to work this week or last week.
Mm-hmm.
How's that transition been? And like even with the cough, but just in general, being working around people now, what's the kind of mood out there?
Yeah. So I don't know how much you know, but I'm doing a fellowship right now in addiction social work. And so I'm not at, regular places for a very long time. So this week I was at St. Paul's downtown, and I was on the addiction medicine consult team, and it felt it was so many things. I had a lot of different feelings and experiences. I was with another social worker, and I was doing consults all over the hospital for people who were referred to the addiction medicine team. And it was my first time in a hospital since COVID really happened, or was announced as such a pandemic. And yeah, the PPE, I was nervous about that because I'm also a lifelong sweater and I'm very
Oh,
sweaty and I get hot. And but no, we had to wear masks the entire day, except when I was eating. And I felt kind of dehydrated, a bit of a headache at the end of that. And then whenever we went into a patient's room to meet with them, it was the full meal deal: the goggles, the mask,
Mm.
the gown, the gloves. And then you had to be careful about removing it all. You had to, use hand sanitizer before putting on your gloves, hand sanitizer after taking off your gloves. And you couldn't wear the same gloves and gown in two different rooms. You had to take that off and then put on another one.
oh wow.
So it was pretty eye-opening, and just everyone in masks. And just I really feel for the patients, especially ones who are maybe medicated to some degree and don't, maybe aren't very mentally clear, because you don't know who's coming into your
Hmm.
room. Everyone's wearing a mask and gown. Everyone kind of looks like they're doctors or nurses when in fact they're not. I was mistaken for a doctor a few times, and I said I wish I got paid like a doctor, but I don't. And just no one really knows who you are, and it's hard. I think it's a bit hard for patients. You're missing those facial expressions. I'm a very facially expressive person, and just that body language. I think there's probably some communication lacking. However, overall, I think people are doing a really good job. People seem to be really respectful and on board with everything. I think it was new this week. I mean, I don't normally work at St. Paul's. I normally work at BC Women's Hospital in an outpatient clinic, so quite a different environment. But apparently there were people, I didn't really notice them, but people like checkers, like spotters, who are going around the hospital with clipboards and kind of just making sure everybody is doing the proper protocols and PPE guidelines. So that was, kind of interesting. I did notice one or two of them after it was pointed out to me. But yeah, it's a different way of practicing. It's slower. You don't get to see as many people, so I'm sure that will be reflected in stats, just in terms of services and how many providers see somebody, if consults don't happen or if referrals don't happen. It's slower,
Hmm.
because of all the taking on and off and just being really careful around people. But I was impressed. I mean, these folks that I was with in the hospital, they're very used to it, and it was new to me, but they're very proficient at getting on and off their gowns and all their PPE.
Hmm.
I was kind of fumbling with my gloves and things a bit, but no, it felt good to be back into a clinical setting, and feeling like I could put some of my skills to use after not for a couple months.
I think really with everything going on that and the big focus on COVID, people tend to forget that there's all these people out there who need services or are sick or whatever the case may be, and COVID is just like an extra layer of difficulty. Really, it's just
Mm-hmm.
added an extra layer of difficulty. So, like for you for providing services, do you like did you I'm not sure how much interaction you had, but did you notice like were people did they talk about that at all, or do you find that you can still provide the same level of service that you could? Or you, what in your job? What exactly do you do? Do you like help people get resources? Are you there to counsel them, or like how? What kind of social work do you do?
Yeah, so in my normal job, I'm at a clinic at BC Women's, like I mentioned, and it's an HIV and hepatitis C clinic, and I work primarily with women. I work with a lot of Indigenous women. I work primarily downtown East Side. Most of my clients, because I do outreach, so I'm not in the clinic environment all that much, unless I'm accompanying clients to their appointments in clinic. But I'm often out and about. Looking for people. I feel a bit like a detective sometimes, trying to put some recon together. So that right now, from what I've heard, so I've stepped away from my job for this past year to do this fellowship program. But what I'm hearing is that outreach is not happening. And I'm hearing that from other outreach teams in Vancouver Coastal and around the city, that there is very limited outreach happening. And so, whereas I would often help people get to very important, cardiac appointments or cancer screening or cancer treatment appointments, as well as do counseling and just really a lot of walking alongside people and being an advocate. Say if they were to go to the emergency department for something medical related, a lot of my clients have had negative experiences in Emerge and don't want to go until things get really bad. So just being an advocate and somebody else there as someone with a voice and privilege as a white woman, I do carry that, and I'm quite aware of that privilege that I carry. And my heart is breaking for my clients, many of whom I've known for years and I worked with long term, because as we know, HIV isn't curable and it doesn't go away. And often substance use is a chronic relapsing condition. So a lot of my clients, there are ups and downs, but they need some ongoing support. And yeah, my heart breaks right now that due to COVID, my colleagues and many other teams are not able to provide what I think are very important services in linking people to care. There's also, in terms of substance use in particular, groups and things, like none of those are happening right now. AA and NA and all those mutual aid groups, most of those have gone online, which is great if you have a phone or computer with internet access. A lot of folks in, grinding poverty, they often have a phone and then lose it or it gets stolen or it needs to be sold. They don't really have computers or access to computers very much. And so that's not much of an option. Substance use treatment facilities, like residential treatment, a lot of those stopped taking new intakes or they had to reduce their capacity a lot. In terms of overdose prevention and safe consumption sites, those, I believe most of them remained open. However, they had to reduce their capacity by often 50%.
Oh, wow.
So it just really pushes people more into the margins. They're not able to access any kind of group support. I don't know when groups are going to start back up again. And having facilitated many groups in my career, I know the power of group, and especially a lot of women's groups can be very powerful, and just hearing other people's experiences and just being peer led or peer run in a group can be very, very, very powerful and have a big impact. So yeah, I worry about folks who are already stigmatized and in poverty. And, I often have to go hunting for them, to have eyes on them. And knowing that there can't be that outreach and that personal connection right now, it really weighs heavy on me.
Yeah, definitely. I think like I've heard the same thing where like I know even accountants that work in NPOs, and it's just that like even if you can keep the funding moving, now there's no access to get the funds to people because a lot of it was in person to get the funds. It's not like you were depositing to a bank account somewhere.
Exactly.
Yeah, so it's still, I just don't know when that gets better. Like I don't know when that changes.
No, I don't either. And I believe some workers and professionals are trying to advocate that some outreach can happen in a limited capacity anyways, because, people are told, well, just work in the office. That's what my coworkers are told, work in the office and, make phone calls. But as I said, a lot of folks, their numbers
Yeah.
change all the time. And a lot of people, it's strange to think in 2020, but it's a reality. People don't have
Yeah.
phones, and they don't have stable housing to charge their phone. There's all sorts of barriers that we sometimes don't even think about. And so I think COVID is really impacting people, I think, just so beyond what we could have even imagined. There are so many ripple effects and repercussions.
Yeah, I definitely, we wonder the same thing about like our community and how they're doing, because the West End has a lot of homelessness. I'm sure you've been here at some point.
Oh, yes.
And I
Yes.
was thinking about, the residents around the West End. It's kind of just a community. Like you see people bringing food all the time. People are just always giving money and things like that, because not only are these people homeless, but they're also part of your community and live in your neighborhood.
Yeah.
You see the same people.
Yeah.
So I
Yeah.
just wonder now that there's less people. It might be changing now, but yeah, at first when less people were out and like no shops were open and things like that, I was wondering, like how are people coping? Like people that really rely on, the community around them to help support them when they, maybe they're not even accessing services regularly. So yeah, I don't, and then plus we're not out. I don't know what's going on.
Right.
Where we're in.
Yeah.
So
yeah, I felt kind of out of touch. I was doing tons of reading articles and talking to coworkers who were still working in the field or working downtown East Side, other social work friends, and just trying to keep my pulse or my finger on the pulse a little bit, because it was very strange not being out in the community and not being with people with whom I work, client wise and demographic wise. It felt really strange. And so, but all I could really do was, read articles and talk to people who were doing stuff down there, to try and get a little bit of information about what was happening on the street. But it'll be good to continue to get back into more of a routine and back into work and kind of that environment, to know really what is needed going forward for folks who are, just have more barriers and more into accessing care, more vulnerabilities, more health issues, and need the extra support. Because right now I don't really have the answers, because I haven't been on the ground as much as I would have liked to have been.
Have you heard anything or read anything about like COVID specifically in those communities? I assume they'd be more at risk just because things like social distancing and needing to get resources is probably tougher and keeps them around people much more often.
Well, from what I've been hearing, I think many of us who have strong ties specifically to the downtown East Side and people, people living on the street and whatnot, were expecting this huge, epidemic or, COVID infection rate. And from what I've been hearing, it hasn't happened. And I honestly don't understand or know why it hasn't happened, because from what I've been hearing, a lot of people are continuing to do their own thing, say on the downtown East Side, and not adhering to physical distancing just because they can't, or just don't want to, or don't care, or have other priorities going on in their lives. And I'm not sure if it's a lack of cases or a lack of testing, and we just don't know what's really happening. I believe there was a case at Harbor Light. I don't know if it was in their detox or in their more like support recovery treatment facility. But other than that, like there just hasn't been miraculously a big outbreak. And I don't know why, but I'm happy about it.
My hypothesis would be either, like you said, a lot of people don't trust the medical profession, or they've had a negative experience. So even if they did get sick, they're not going to go in unless, it's really, really bad. And then also, I think maybe it's that and I don't know statistically if this is true at all, but I feel like in BC, the people that have gotten it have been aware and maybe have stayed in and only spread it within their like close community. So like people that traveled and came home and spread it within that area. So maybe it's that like those communities haven't been touched by people who have had it.
Because it is
Right.
strange, like we've talked about it before, that, you know, everywhere else, anytime people kind of get around each other, we see these little explosion of cases. And for some reason, even though
Yeah.
Vancouver, we have a lot of places where you would expect, based on how many people are gathering, we really haven't seen it. And yeah, we're curious whether it's just
Yeah.
dumb luck that there just weren't enough cases at the beginning to spur something like that, or
maybe we have like a different strain, because you know how when they did the lines of how it like kind of mutated between each country, and even so I was reading about a choir group in Oregon, I believe it was, and one person had it, and it was something like out of 52 people that attended, 37 people got it, 2 died, just because one person had it. But then here you don't hear that. But I don't know if it's that we started distancing fast enough, or if the form that we have here isn't as contagious.
or that most of our interactions are outdoors, which is different than like sitting in a church or
singing. Yeah.
Right. Belting out with your moist singing. Yeah, I don't know. I don't know. I feel very fortunate that I mean, of course, many, you know, we're up to, I think, what is it, 157 people, I think, have died, 159 as of today. You know, of course, that's, you know, those are not great numbers, but in terms of comparing those numbers to other provinces and around the world, they're actually really good numbers. Yeah, I don't know. I think it's a combination of things. I really do. And maybe we'll get more information about the strain, and if it wasn't as contagious, probably the weather has helped in a way, being able to be outside. I think maybe our spring break was a contributing factor as well, right? And there's something else I was just going to say. I'm going to keep pondering. I forgot what it was. I'm so sorry.
Yeah, I wonder though, because Quebec was hit really hard, and if you think maybe at that time it was colder there, maybe more people were indoors, where for us in like, you know, spring break, that time, like even us, we were outside all the time. Like even if it's pouring rain, we're outside. We're just trying to be outside. So,
yeah. Oh, I know what I was going to say. Maybe the safer supply of, in terms of, you know, downtown east side stuff, of substances and pharmaceutical grade replacements or substitutions. Maybe that's had a good effect, although, you know, that kind of came beginning of April. So we still had a lot of time for people to potentially, you know, spread the virus. I don't know.
Especially in places like homeless shelters where, you know, I'm sure or I don't know if I shouldn't say I'm sure, but I'm guessing they've reduced how many.
I believe they have. Yeah.
And still, you know, haven't heard of any outbreak like that or anything.
Yeah. And aside from the federal prison out in Mission, I spent some time at a women's prison in Maple Ridge earlier this year. And that was actually, I remember being there on the day that COVID was named, and they announced it in our morning huddle. And they said, okay, so the coronavirus, it's now being called COVID-19. And I said, okay, you know, we're all saying, yeah, that makes sense. We get it. And then the next day at the meeting, a nurse said, okay, we have 500 N95 masks. And she showed one of them. She's like, now we have 499, because I'm going to have to throw this one out. And I remember just thinking, oh my, afterwards, later, it would be horrendous. I don't even know what people would do if it got into prisons. And yet it seems to be mainly the one prison in Mission and not the other prisons. So again, I don't know how that has been. Of course, it was 100 and something people that got infected at the Mission institution, which is not great. But I don't know how the other institutions have managed to avoid getting the virus in very close quarters with guards, healthcare workers, prisoners themselves. It's, again, kind of miraculous.
Yeah. I mean, I think it's the people going in and out, being diligent and just really being self-aware. Like, I don't normally, when I get a fever, I probably am like second guessing, like, do I have a fever? Nah, I think I'm okay. And then later I'll be like, whoa, I totally had a fever.
Yeah.
But
or just take some
Yeah,
Tylenol and
off you
off you go,
go.
right?
But maybe they were just
Yeah.
really self-aware in the beginning, like, yeah, okay, I don't mask this. I actually wait and see if I do have a fever before I go in, or, who knows if it's allergies, I'll stay
Yeah.
home today. Yeah.
Right. I know we're in allergy season now, which makes it
Yeah.
hard as well. Yeah, everyone in the hay fever, right? Yeah, no, it's so many unknowns. I hope we get some more answers as time goes by and get to know more about the BC situation, because I just find it's so
Mm-hmm.
unique compared to across Canada. And I think we've had great leadership. I think most people, at least outside of Vancouver, have done really well, and hopefully Vancouver has gotten more on board with all the rules. But yeah, I mean, BC has really done a lot better than the bigger provinces across the country. So, and I don't have all the
Yeah,
answers.
I hope we continue to do well and that it goes away. I want it to go away, even if
I
it's just here.
know.
I want to be like Vancouver Island and be like, we have one case, we'll follow the rules, but we don't have much
Mm-hmm.
to worry about. But
Yes.
so on our podcast, we do like to end on a positive note. So is there anything
Yeah.
you've really been through it, and I feel like even now, like, you definitely see the more at-risk side of people. Do you have any positive takeaways that you've seen during this time that you just like to share, or that yeah, just like what's been positive about this experience?
Okay. Well, something that I haven't talked about yet on the podcast, but being in Richmond, well, actually, I wasn't part of the original group of people that created I think it's called Coming Together Richmond COVID-19 or something, but it's part of other, there's also a Vancouver branch of this Facebook group. And it's, it was founded on the response to COVID, and connecting community
Mm-hmm.
members together if people need things, or if they have things to donate, or just information. And I got on the admin team, knowing a couple people who were running the group, and we started. And I think I just love this. We started a, a group of drivers to help deliver food bank hampers for vulnerable folks who are not able to either get to the food bank themselves because they're
Mm-hmm.
sick, they're high risk, they have mobility issues. The only location in Richmond for the food bank that is open is the main warehouse location. All of the other satellite locations had to be shut down because they were in community centers primarily. And of course, community centers aren't
Mm-hmm.
open right now. And so it's been amazing. Tons of people volunteered to be drivers on their own time, on their own gas. Like, we don't have any money
Mm-hmm.
or anything. It was just people coming together. And I've kind of taken over assigning clients to drivers. And it's been a little up and down in terms of busyness over the last couple months. From what I hear from the food bank, there's a lot more demand for food, probably as people are in precarious financial
Mm-hmm.
situations. But what I love about what's happened here is that the drivers, I kind of did this on purpose. I assigned clients to regular drivers so that they would be seen every week by the same person. And it sounds like some, friendships or relationships, and at least friendly interactions are happening now. And I think people are starting to meet folks in their community that they wouldn't otherwise
Mm-hmm.
have met, and maybe breaking down some stigma and some discrimination about who uses the food bank and who needs it. And we're hoping maybe in the summer, maybe when things calm down a bit, to get this group of drivers. And I don't know them. I mean, they just email me. I've never met them, but to maybe get together as a group and kind of maybe have a potluck. Or I guess no, probably potluck wouldn't be good because we'd be sharing germs. But a BYO picnic or something, and to really kind of celebrate that we came together when the community needed us. And I think we're doing somewhere upwards of like 50 or 60 deliveries a
Wow.
week in Richmond. Yeah. So that's something positive that I'm taking away from this
So if
experience.
anybody wanted to, like, if anybody in Richmond were listening and they wanted to become a part of that group, how would they find it?
So, Coming Together Richmond COVID-19 is the name of it. It's
Mm-hmm.
kind of a long name. And then we do have an email that I look at multiple times a day. And the address is Coming Together Richmond. Yeah, I always think it's double R, Coming Together Richmond at gmail.com. And if they want to get involved in any way, or, want to sign up as a volunteer driver, I believe we're going to keep needing that. We're going to keep needing that for a little while longer. They're more than welcome to, and I will respond.
That's so awesome. Yeah, I mean, we see, we sometimes see, like you spoke about earlier, like people shaming people, and there's internet trolls, but then there's this whole part of society that really steps up and, comes together and wants to help people. So that's awesome to hear.
Yeah, and it's nice to keep hearing those stories, because we have to keep the faith and have to remember that most people are good, and keep hope, that, we are good most of the time.
Thank you so much for coming on. It's just been a pleasure talking with you. And I hope we could keep in touch, because I'm really interested to hear what happens with your husband's test results, and also like as the world continues to change, as you go back to work, and like what's happening out there. What's happening?
Absolutely.
What's happening?
Yeah, what's happening? No, this has been really fun. And thank you so much for inviting me on. And yeah, it's been a real pleasure as well. So we can definitely
great.
keep in touch.
Awesome. Thank you so much, Ainsley.
Okay. Have a wonderful rest of
you
your
too.
Have a great night.
Okay.
Bye.
Thank you.